Welcome to the Victory Education Lounge. I'm your host Morris, and we're thrilled to have you join us for another exciting episode. Before we dive in, don't forget to like, subscribe, and leave a comment below sharing your thoughts or experiences. Your engagement helps us create more valuable content for you. Today we're exploring part 129 of our series, Liposuction, Cosmetic or Therapeutic. Liposuction has long been associated with cosmetic enhancements, but recent research has sparked discussions about its potential therapeutic benefits, particularly in relation to metabolic health. Let's dive into the world of liposuction and explore its possible impacts beyond aesthetics. Ever wondered if liposuction, widely known for its cosmetic applications, could also have therapeutic benefits? Liposuction, a surgical procedure that removes subcutaneous fat from specific areas of the body, has traditionally been a go-to for those seeking to improve their body shape and proportions. But beyond the realm of aesthetics, there's a growing interest in the potential metabolic effects of this procedure. Recent research suggests that liposuction might play a role not only in body contouring, but also in the removal of problematic fat deposits that may be metabolically active. This dual nature of liposuction, straddling the cosmetic and the therapeutic, opens up a fascinating realm of possibilities. But remember, any health-related decisions, especially those involving surgical procedures, should always be discussed with a licensed physician. So with that in mind, let's delve deeper into this fascinating topic. Firstly, liposuction is known for fat removal and body contouring. This surgical procedure targets subcutaneous fat, sculpting the body into more desirable proportions. It's like a master artist chiseling away the excess to reveal a masterpiece underneath. Now, that's the cosmetic side of things. But what about the therapeutic potential? Imagine fat deposits as little metabolic factories, churning out substances that can impact our health. Removing these problematic factories might theoretically confer some health benefits. Picture, for instance, the removal of abdominal subcutaneous fat. Some studies suggest this could lead to improvements in insulin sensitivity, a crucial aspect of metabolic health. So, liposuction isn't just about looking good in a swimsuit. It could also be a tool for managing certain health conditions, although much more research is needed in this area. Interesting, isn't it? Let's move to the next point. Next, we explore liposuction's impact on visceral fat. Visceral fat. That's the fat surrounding our organs, not the subcutaneous fat that liposuction targets. Interestingly, while liposuction doesn't directly remove visceral fat, it might still have a say in its metabolism. How so, you ask? Well, research points to the possibility of liposuction triggering compensatory decreases in visceral fat. In other words, when subcutaneous fat is removed, the body might respond by reducing visceral fat levels. However, it's important to note that this reaction isn't guaranteed and may vary from person to person. Further studies are needed to fully understand the relationship between liposuction and visceral fat. That being said, the potential for indirect influence on visceral fat metabolism adds another layer to the conversation about liposuction's therapeutic potential. Fascinating, isn't it? Let's continue to the next aspect. Now let's discuss how liposuction can affect insulin sensitivity. This is a topic that has garnered a lot of interest in the scientific community. The reason for this is that insulin sensitivity plays a crucial role in metabolic health. So, does liposuction have an impact? The answer isn't straightforward. Some studies have shown that liposuction, specifically when it removes a large volume of fat, can lead to improvements in insulin sensitivity. For example, a small study found that obese women who underwent large volume liposuction experienced improved insulin sensitivity. However, not all research aligns with these findings. Other studies have reported no significant changes, and some have even suggested a potential worsening in insulin sensitivity post-liposuction. It's important to note that these mixed results indicate the need for further research in this area. Let's move on to how liposuction can influence inflammatory markers. In this segment, we examine liposuction's effect on inflammatory markers. Now you may be wondering, what are inflammatory markers? Well, think of them as the body's alarm signals. They rise in response to distress or damage in the body. Research shows that liposuction could potentially cause a reduction in these markers. This is quite an interesting discovery, as inflammation is linked to various health issues, including heart disease and diabetes. One study found a decrease in inflammatory cytokines, specifically tumor necrosis factor alpha, after liposuction. TNF-alpha is a key player in systemic inflammation, so lowering its levels could potentially reduce the risk of chronic diseases. However, before we get too excited, it's important to note that more research is needed in this area. But the potential for liposuction to have an impact beyond cosmetic enhancements is certainly intriguing. Interestingly, liposuction may also affect lipid profiles. Let's see how. Now, we delve into liposuction's potential effects on lipid profiles. Lipids, as you may already know, are a group of fats and fat-like substances essential to our health. However, when out of balance, they can contribute to various health issues, including heart disease. In the context of liposuction, we're particularly interested in cholesterol levels. Cholesterol is a type of lipid found in the blood, and it's crucial for building healthy cells. But high levels of certain types of cholesterol, specifically low-density lipoprotein or LDL, can lead to heart disease. Now, some studies suggest that liposuction might lead to improvements in cholesterol levels, specifically increasing high-density lipoprotein or HDL, often referred to as good cholesterol. However, it's important to note that these results have been inconsistent, and more research is needed to establish a strong link. So, while the potential is there, it's not a guarantee. Next, we'll look at how liposuction could potentially alter adipokine production. In this part, we explore the potential impact of liposuction on adipokine production. Adipokines are bioactive hormones produced by adipose tissue. They play important roles in various metabolic processes, including appetite regulation, insulin sensitivity, and inflammation. Now imagine if liposuction could influence these hormones. When fat is removed through liposuction, it's not just about losing weight or changing body shape, it's also about the possible alterations in the production of adipokines. Some studies have shown that liposuction can lead to changes in levels of adipokines such as leptin, an important hormone that regulates appetite and energy expenditure. This could potentially affect metabolic health. However, the research on this topic is mixed and still emerging. Some studies suggest positive effects, while others show no significant changes. It's a complex area that requires further investigation, but the potential implications for metabolic health make it a fascinating area of study. Lastly, we'll discuss the long-term metabolic effects of liposuction. Finally, we examine the potential long-term metabolic effects of liposuction. While it's clear that liposuction can bring immediate changes to body contour and composition, the long-term metabolic impacts remain a topic of ongoing research. Some studies suggest that any improvements in metabolic markers such as insulin sensitivity or inflammatory cytokine levels may be temporary without concurrent lifestyle changes. In other words, liposuction alone might not be a silver bullet for metabolic health. However, it could potentially be a catalyst, kickstarting a journey towards improved metabolic health when combined with a balanced diet, regular physical activity, and other healthy lifestyle choices. It's important to note that this is a complex, multifaceted topic, and our understanding is continually evolving. More research is needed to fully unveil the long-term metabolic effects of liposuction. To wrap up, let's ponder some key considerations regarding liposuction and its potential therapeutic applications. As we conclude, it's important to discuss some key considerations. Liposuction, whether for cosmetic or therapeutic purposes, is not a one-size-fits-all solution. It's crucial to remember that patient selection plays a significant role in the outcomes of this procedure. Just as a painter carefully chooses the canvas for their masterpiece, a surgeon must carefully select the appropriate patient for liposuction. This is because the potential metabolic benefits of this procedure might not be applicable to everyone. For instance, individuals with underlying metabolic disorders or those with a high body mass index may not reap the same therapeutic benefits as others. Therefore, thorough medical evaluation and thoughtful patient selection are indispensable. Moving on, let's talk about potential risks. As with any surgical procedure, liposuction carries certain risks, including infection, bleeding, and complications from anesthesia. Additionally, there's a risk of changes in skin sensation and contour irregularities. While these risks are generally low, they are important factors to consider when weighing the pros and cons of liposuction. Now, let's touch upon the importance of lifestyle changes. Liposuction is not a substitute for a healthy lifestyle. Even if liposuction has potential therapeutic benefits, these cannot replace a balanced diet and regular exercise. In fact, maintaining a healthy lifestyle is crucial in preserving the results of liposuction, whether they are cosmetic or potentially therapeutic. This means that the patient's commitment to a healthy lifestyle is as important as the surgery itself. Finally, we must stress that while we've discussed potential therapeutic aspects, liposuction is primarily a cosmetic procedure. Any potential therapeutic benefits are still being researched and are not the primary goal of this surgery. In conclusion, while liposuction remains primarily a cosmetic procedure, ongoing research into its potential metabolic effects opens interesting avenues for discussion. However, it's crucial to approach these potential benefits with caution and skepticism. More research is needed to fully understand the metabolic impacts of liposuction, and it should never be viewed as a substitute for a healthy lifestyle. For those struggling with metabolic issues, traditional approaches like diet, exercise, and medical management under the guidance of healthcare professionals remain the gold standard. Liposuction, if considered, should be viewed as a potential adjunct to these fundamental approaches, not a replacement for them. Thank you for joining us in the Victory Education Lounge. If you found this video helpful, please give it a thumbs up and share it with friends who might benefit. Don't forget to subscribe for more content on health, wellness, and personal development. Until next time, stay informed, stay healthy, and keep striving for victory in all aspects of your life. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications.